Just want to give a few brief words about, since there's a lot of panic about the coronavirus. Yes, as Imam said, coronavirus is not new. It's been around for some time. However, this one is a mutant. It's a mutation. It's changed a little bit. Originally, they think the source was from bats or some mammals or some birds in China, because they deal with these markets where they sell a lot of these live animals. And then there's an intermediary, and it went to humans. Now it has become a human-to-human transfer, and it affects your respiratory system. It's actually a virus that affects your lungs, and seems to affect this receptor called angiotensin, which all have in our lungs, and that's where it starts to destroy your lung tissue. So the first symptom of this virus is a fever. That seems to be the most consistent finding. Over 99% of the people will manifest with fever, unlike the other viruses which we have sore throat, runny nose. This one starts as a fever. And about 60% of people will have a cough as the lung gets more. So it becomes kind of a peculiar pneumonia. It seems to be that the people who smoke, people who are elderly, and who have diabetes, who have lung disease, seems to be the worst off in this condition. The younger people, particularly the children, are somehow, God's grace, spared. They seem to tolerate it much better, or even spared completely. Right now, the data which has come from China is that about 30% of people will escape altogether, even if they live in the same area. Only 70% of us will catch it. Now, those who catch it, 80% will still not have a severe disease. So that's a good number. Only 20% will have severe disease, and at this point, the mortality or the death rate is between 2 to 5%. Now, that number is changing every day, because most of the people who are being counted, particularly like in the United States, is in nursing homes. They tend to be elderly, they are sick, so the number is high. They think this number will come down. The problem we do have is, A, we don't have a good screening method, and we don't have good treatment. Right now, you will see some signs in the hospitals. They are checking for anybody who has a fever. Please do not enter the hospital. So the fever is the only way we have. In fact, the airports are putting some thermal mechanisms where they can check your temperature from a distance. So this is going to be the way to do. If anybody has a fever in the community, please stay home and check with your doctor, because that's our only marker. Unfortunately, it's 1 to 10 days before even you might have a fever, and you may have the virus in you. So we don't know the early prodromers, those who have early disease. We don't know how to exactly recognize that, and that's the limitation. There is a worldwide concern that this thing is very infectious. You catch it as quickly as the plague, or it's much faster than the flu. However, the mortality rate is lower than the flu. Last year, apparently, I understand about 100,000 people around the world died of flu. And so far, the number hasn't even gone to 10,000 with this one. But of course, it's early. It's only been 2 months. We don't know what the cycle will be. There's a lot of unanswered question about this virus as to how far it's going to go, who's going to. Pasco County has no cases so far. We don't need to panic, but we don't know yet. The Public Health Department is doing a good job of trying to screen, send information. The test kits will be available in most hospitals by next week, from what we understand from CDC. So far, no hospital has any test kits. The other issue is, of course, what can you do to prevent it? Well, if somebody in your family has a fever, please try to be careful, not directly touch. It comes by contact, and also by droplets, by coughing, much more than touching. So if somebody is coughing, be careful, particularly if they have fever and cough. That seems to be the hallmark to stay away from that part of a person. If there's a concern, try to at least get it checked out through the Public Health Department. Your doctors may not be able to help you right now because we have no test kits, but Public Health Department is helping out with that. There is no specific treatment we can tell you. Yes, washing your hands is always good. It's a good precaution. And of course, try to stay away. Face masks don't seem to have helped yet. So don't need to start putting face masks at this point unless we have any definite reasons. In the hospital, of course, we will have to be wearing with special gowns and special masks to try to prevent any entry of the viruses, because it seems to be about 40% of the healthcare workers do get infected when they take care of these patients. So that's the problem. There are no antibiotics which will work for it. Antiviral drugs are being tried, but none of them. There's one drug which was used for Ebola, seems to have some effectiveness, but it's not yet available, not yet approved. So that's about all I can tell you about this. If anybody has any burning question, I'll try.
If it spreads, are we going to cancel the Jummah prayer?
Well, if we have, yes, if you get really exposed, in Iran, they have, as you know, stopped Jummah prayers, because they, of course, pray one prayer in the whole town. But large congregations are at risk, and they are even thinking about cancelling some football, some basketball games and all of those. So once you start to have, and it starts to become real epidemic, right now I think it's too early for us to panic. And it's your choice whether you shake hands or not. Some people are doing fist bump, because as I said, the most transmission is by droplets. Touching hands is not going to do it, it's by your coughing on each other. So it's the air which you're going to breathe. And I don't know how you can stop the air from breathing.
Does it really hand sanitizer kill it?
I'm sorry?
Does the hand sanitizer or alcohol kill the virus or not?
Not really, no. Actually, it does kill a little bit, but nothing really, as I said, you inhale the virus. So it's your lungs, it's not the skin transmission. But yes, if you have it in your hands and then you go and touch your nose, you might get some of it. So there's a small protection. Jazakallah.